Good morning, good afternoon, or good evening to those of you who have joined us for this webinar on evaluating the risks and benefits of research for adolescents, a perspective from the lens of institutional review boards. I'm Bob Blum, and I am the lead for the Global Early Adolescence Study. This webinar is part of a collaborative effort with the World Health Organization and partners around the world to bring together the learning that has been done, not just from the Global Early Adolescence Study, but from those of us who work with research with adolescents in low and middle income countries, and particularly with adolescents who live in vulnerable communities in those settings. I am thrilled that we have as illustrious a panel to discuss these issues as we do, and I'll introduce them in a minute. But I would just like to point out a couple of things. You will notice that there's icons for sound and video. Please make sure those are off, otherwise we get a tremendous amount of background noise. The second is that throughout the webinar, we would ask that you type comments or questions in the chat box. We will be reviewing those on an ongoing basis, synthesizing them, forwarding them on to our colleagues in Geneva, and they will be using this as the basis for discussion. And you do not need to wait till the end. This is something that can and should be done on an ongoing basis throughout the webinar. It is a 1-hour webinar, and we will end promptly at the start of the new hour. Next slide, please. I'd like to introduce our 4 speakers and panelists and moderator. And so going from top down, Jerome Singh is head of Ethics and Law Center for the AIDS program of research in South Africa. He is at the Nelson Mandela School of Medicine, the University of KwaZulu-Natal. He's also an adjunct professor in clinical public health at the Dalai Lama School of Public Health and the Joint Center for Bioethics at the University of Toronto in Canada. He leads a course on bioethics and law at Howard College School of Law at his university. His principal investigator and director of Ethical, Legal, Social, and Cultural Issues Program on Synthetic Biology, which is established and supported by the Bill and Melinda Gates Foundation. Abba Saxena came to the World Health Organization in 2001, and for the subsequent 16 years, from 2002 to 18, she was the manager of WHO's Research Ethics Program and the Ethical Review Board. Additionally, for 5 years, 2013 to 18, she coordinated the Global Health Ethics team at WHO, developing documents and guidelines and establishing a public health ethics consultative group. She transitioned from WHO in 2018, and since then, Dr. Saxena has focused her attention on training and research in global bioethics, following her interest in ethics of health systems research, human challenge studies, and new technologies. She's currently a senior bioethics advisor to the Inclin Trust, where she has responsibility for training and mentoring researchers, as well as advising their ethics committee. Joan Pettit is a colleague of mine here at Johns Hopkins Bloomberg School of Public Health. She's the executive director of the Institutional Review Board here. She has a law degree as well as a master's in ethics. Here at Hopkins, she's affiliated faculty with the Bierman Institute of Bioethics and helps train Fogarty scholars on IRB operations. She teaches the informed consent portion of practical skills in conducting research in clinical epidemiology, a course offered here at the Bloomberg School of Public Health. She's a Fulbright specialist in the area of IRBs and human subject research, and her work has taken her to Trinidad, Myanmar, New Zealand, Zambia, China to address issues of IRB operations and research ethics training. Serving as moderator today is a close colleague, Dr. Chandramouli. He leads the adolescent sexual and reproductive health work at WHO's Department of Reproductive Health and Research, HRP. His work includes building the evidence base on adolescent sexual and reproductive health and supporting countries to translate this evidence into action through well-conceived and well-managed policies and programs. He has experience in generating knowledge of over 30 years and taking knowledge to action. And so it is a tremendous pleasure to have you all join us. Maybe before I turn this over to Chandra, let me ask each of the panelists, when you think about research with adolescents from your lens, is there one particular image or issue that sticks out in your mind? Very briefly and quickly. Jerome, do you want to just jump in? And then we'll just ask Abba and Joan to comment.
I think probably in my mind, one of the things that I always wonder about is how does an adolescent view a researcher? And they, wondering why are you asking me these questions, or why are you interested in my life? They haven't had enough life experiences yet to understand research and dissemination of research and impact on policy. So I always wonder when we go to study participants, but especially adolescents, is them wondering why are you asking me these questions, and getting them to understand why you're asking them questions, why it's important, and how it could actually change the world or change their policies and their settings. So I think for me, that's what I always ask myself is what do they think about investigators and researchers when they do come?
Thank you. Abba.
Hi, good morning, afternoon, evening, everybody. For me, while it's key that balancing of autonomy and privacy of adolescents should be respected, it's also important that the researchers need to be respectful of parental responsibilities and rights. However, for me, there's no one single solution for all, and principles are key to making ethical decision making. But it's equally important that researchers, while working with adolescents, reflect deeply about the issues and know their subject matter well, very deeply, and they need to act responsibly, understanding what are the risks to adolescents and how can principles be applied to one particular situation, rather than applying them without thinking about how it applies to that situation. So for me, it's that being mindful of the fact that each individual has a different situation and principles need to be modified to do that. Thank you.
Thank you very much. Let me turn it to Joan Pettit.
Good morning. My main concern is the vulnerability of the adolescent. Often this age group doesn't understand the consequences of their decisions, especially in an area like research where they have very little experience. So even if they agree to something that with some sort of expectations of what the experience will be about, I'm concerned that they don't understand the consequences of deciding to join.
Thank you very much. So the way that we will be moving forward is that we have built this entire conversation around a case and a set of questions. To moderate that is, as I noted, our colleague Chandramouli from the World Health Organization. Maybe we can have the next slide, and Chandra, let me turn this over to you.
Thank you, Bob, and greetings, everyone. Greetings from Geneva on an overcast winter's day. Greetings to you, Jerome, to Abba, and Joan. Before I launch into the case study, I'd like to share my own perspectives on adolescence and research. Having worked now in WHO for over 25 years, one of the issues that comes up several times is that because of the reasons that Abba and Joan raised, Joan talked about the vulnerability of adolescence, and Abba talked about finding the right balance between autonomy on the one hand and parental rights and responsibilities on the other. In many occasions, research studies that could include adolescents leave them out. So it's difficult, it's a little complicated, and rather than add to our complications, researchers say, let's just leave that group out. So for me, one of my big pushes has been, what could we do to make sure that we make life easy for researchers and research review boards to move forward in a way that takes into account the needs and fulfills the rights of adolescents. And that's what the focus of today's discussion is about. So let me read the case study out aloud. An institutional review board application has been submitted by a team of investigators to undertake a 3-site study of sexual health among adolescents aged 10 to 16. And the 3 sites are the 3 sites of our panelists. One is Durban in South Africa, one is Baltimore in the US, and the third is Mumbai in India. Although Abba comes originally from Delhi, she has traveled and worked extensively in India and can speak authoritatively about that site. Now, aware that sexual abuse is a significant issue in all 3 sites, the investigators propose questions related to sexual violence, both current and in the past. Please remember that the study involves 10 to 16-year-olds, legal minors in all these 3 contexts, as well as a range of questions related to sexual knowledge, attitudes, beliefs, and behaviors. So that's the case study. That's the case study that we're going to discuss. And what we're going to do is we have 3 questions. And we'd like to take about 10 to 12 minutes on each of these questions so that we can have a small discussion and then wrap up the discussion. The next slide, please. So the first question is, what factors will you take into consideration when assessing the application, and how, if at all, will that vary by site or cultural context? So the rules of the game, Jerome, Abba, and Joan are, this particular question, I'll start with you first, Joan. And what you have is a couple of minutes to share your answers to this question. And my request to Abba, who will come next, and then Jerome, who will come third, is to add to what Joan says. You can reinforce what she says quickly or disagree with what she says, but principally add what you have. And then what we can do is see what comes from the floor in terms of discussion. Over to you, Joan.
Okay, thank you. I'll try to be succinct. The four factors that I isolated as what are most important to me are the vulnerability of the target population, risk and benefit, consent, and mandatory reporting. Starting with vulnerability, if you're going to ask these kinds of questions, the vulnerability of the adolescent varies depending on the context. For example, if you are in a clinical setting where a clinician is asking the questions and there are all kinds of privacy protections already built into that setting is less risky than if you're going into a minor's household where there might be parental or other caregiver interest in these questions that you're about to ask a member of their family. The risk and benefit is also a critical issue, because if you're asking questions, there's generally, in a research setting, not going to be any benefit to these adolescents. So you start out with the premise that this is a no benefit study. So you must consider the risk consequences of asking these questions of adolescents. And if you cannot mitigate them, then you can't ask them. So that's the next part. The next issue for me is consent. And in the United States, this is tricky because each state, not the federal government, but each state controls issues of consent. So if you're in the state of Maryland, for example, and an adolescent is coming into a clinician setting, the clinician typically can provide treatment or advice for sexually transmitted diseases or reproductive health issues. In Maryland, an adolescent can consent for him or herself to a research study that is also related to treatment or advice of those issues. But if you're out in the community, that's not the case. The adolescent typically cannot consent for him or herself unless the IRB finds some way to waive parental permission. So the context is important. And then in America, you have mandatory reporting laws. If an adolescent discloses that there has been an event of sexual violence in their past or any other kind of abuse or neglect, then the clinician, the researcher, the healthcare giver has a mandatory reporting requirement to notify local authorities. So one of the issues that we have to face is how do you make sure the adolescent understands that before they respond to any of your questions? So I'm going to stop there.
Thank you, Joan. Differential levels of vulnerability depending on the setting in which the questions are being asked. What's in it for the adolescent in terms of benefits and what are potential risks. And this whole issue of consent and then reporting requirements and the implications of that for the adolescent. You mentioned 4 points. I captured 3. Did I miss one?
Vulnerability, risk, benefit, consent, and mandatory reporting.
And mandatory reporting. Thank you, Joan. Over to you, Abba.
Thanks, Chandra. So I have a slightly different take on the case study. And for me, it looked like the study is on sexual health. And then the researchers want to ask questions about sexual violence. And to me, this latter part of the study, sexual violence experiences, is not the same as questions on sexual health. And for me, the sexual violence experience study needs a different methodology, a different approach. And I don't think that the two can be combined in the same study. So if I were an IRB member, I would ask them to give me a good justification for doing that. Give me a reason for why they're doing it. So make sure that the social value of the study exists. And for me, right now it's missing, because I don't know whether out of once they complete the study, what is it in it for the youngsters who report or who give experiences of sexual violence, whether they're going to have any benefit from this study. So that's the first main thing. That's my main objection to, my main concern about this study. And then, of course, all the issues about consent and risk benefit that Joan mentioned. So that's fine. But another thing that the questionnaires I would like to know is if these questionnaires are age sensitive. This is a very varied group from 10 years to 16 years, I think. And the understanding of kids from 10 to 12 or 14 years is very different from the older adolescent. So I would like to see that the investigators have thought through this and have prepared age-sensitive questionnaires. The third thing I would like to make sure is that the counseling for these kids is available prior to taking part in the study and after they have participated in the study. And also that if the study uncovers certain, like if the study or during the course of the question survey, if the adolescents reveal a need to access specialized services because of whatever experiences they have had, then is the study providing that service? And if not, first, is it that such services are available in the community that the study is taking part? And if it's not available, and if there is a need to do the study the way it is proposed, then have the investigators made arrangements for, at least temporarily during the course of the study, to have such services available. And finally, I think prior to doing the study, I would ask investigators if they have done their homework well. Have they done a formative study to understand the issues, the cultural issues, the social aspects? What is the understanding of the community about the issues? Are they receptive to the study taking place there? And if not, then what needs to be done in order to make them, to make the study more acceptable to the communities where it's going to take place?
Thank you. Thank you, Abba. Thank you for your comments. As I heard you, I could see that you were reinforcing at least 3 points that Joan made. One is understanding the issues in the context, and that in a way relates to the point she made about differential levels of vulnerability in different settings. You also touched on the importance of consent. I think what you highlighted is that you would pay greater attention to a study on sexual violence than a study which only asked about knowledge, attitudes, and beliefs. And of course, an important consideration in asking questions about sexual violence of this group is to respond to a need. And so the 3 additional points that I take away from your contribution are a particular attention to age, because we are talking about a broad age band, 10 to 16, and the availability of counseling services. This relates to Jerome's initial point about, do they understand what the issues are, even if they can't legally give consent. In order to give assent, do they have a clear understanding of what the study is? And lastly, access to issues. And this is a very big issue. Many of these studies are carried out in places where health and counseling services are not available. What then is the responsibility of the researcher in this context? Jerome, keeping track of time, it is 25 minutes into the hour, a quick response so that we can then go into question 2, which I'd like you to start with. Over to you now. A quick response to question 1, to add to what Joan and Abba have said.
Okay, because the study looks at 2 issues, but related issues, sexual violence and sexual knowledge, beliefs, and attitudes, I think for me, some of the questions that I will ask is, number 1, what is the age of sexual consent in the country or in that setting? Number 2, what is the social and cultural milieu? So in particular, what are the settings, customary practices that may conflict with the law or ethical obligations? So for example, in South Africa, we've got very specific laws on child marriage that sets out minimum ages, on virginity testing, etc. The third question I'll ask is what constitutes abuse in that setting, because that helps to answer the question about sexual violence, because you have to characterize and know what violence is for it to be characterized as violence. I would say, what constitutes abuse there? So for example, in South Africa, we have different ages of consent for different sexual acts. Our Sexual Offences Act has got ages of consent for oral sex, masturbation, etc. They may not necessarily constitute sexual abuse or sexual violence. I'd also ask, what are the exceptions to the age of consent for different sexual acts? So for example, we have a 2-year age gap. So while it may be deemed to be a sexual assault or sexual abuse, if the age gap is between 2 years and both parties consented, it doesn't necessarily get characterized in that way, whereas below a certain age it does. I'd also ask, what are the disclosure obligations for children in that setting? Are there any time limits for reporting abuse? And the last question I would consider is, who is obliged to report? And are study staff compelled to report? Because in some countries, there are very specific categories of people who are obliged to report. And so those are the 6 main questions that I would answer in terms of question 1.
Thank you, Jerome. So the points you've raised are issues that you'd like to have answers to as you go forward. Clearly, while we're having this discussion, there are ethical guidance documents in place published by international bodies, also by national bodies. But this discussion is about your perspectives. And of course, your perspectives are drawn both from these normative documents, but also from your experience. So this has been an interesting first round, asking you 3 highly experienced researchers and research ethics board members, some first set of questions that you would take into account. And let's move to the second question. Next slide, please. So let me read this question out aloud. Given that the proposed study asks both about adverse childhood experiences, as well as about sexual abuse, which is one very important adverse childhood experience, what protections would you as an IRB member expect to see before allowing such questions to be asked? To some extent, you've already answered these questions, ABBA, for instance, but I'd like to have quick responses. I gave you the leeway for longer responses for the first one, but I'd like short responses so that we have at least 20 minutes for discussion at the end. And second question is, in your opinion, what is the responsibility of investigators if a respondent indicated exposures to trauma or violence? Again, this was something that Abba touched on and Jerome also briefly touched on. So can I please ask for 1-minute responses to this question from all 3 of you? Starting with you, Jerome, this time.
Okay, so the 3 questions I would ask is, are there trained counselors available if respondents experience emotional distress as a result of the study? The second is, if the study protocol mentions referral to counseling versus having in-study counselors available, what are the waiting times on average for those participants to get access to that counseling facility? And lastly, what is the study standard operating protocol on disclosure obligations? I would like to see those 3 things in terms of assessing what protections would be available for me to assess whether the study should be permitted or not.
So are there trained counselors? And if there are counselors, what's the waiting time? What is the mechanism to get access to them? And then what's the standard operating procedure for disclosure? Thank you, Jerome, for responding to my plea to be succinct. Over to you, Abba.
So just adding on to what Jerome said, with whom I agree, I think I would insist on knowing what sort of training the researchers have received and how well equipped they are to deal with all sorts of issues that may come up when discussing these questions. And finally, if there is going to be some sort of a follow-up of the study to make sure that, if relevant, policymakers are aware of the study and are tuned to making this recommendations incorporated into policy where relevant. So, yeah.
Thank you, Abba. So again, you in addition to the counseling discussions, you've looked at, and I know you've raised this several times in the ethics review committee discussions here in WHO about, what training and support do researchers, and not just the researchers who are sitting in the offices, but the people working in the field have. Would you like to add something to that?
No, I think, yes, you're right. The whole research team needs to be trained. It's not just the researchers in the office. And what the other thing I was saying was, if there is some outcome from the study, how is it going to be incorporated into management at the health level? So, are you going to make changes so that something good comes out of the study?
Thank you. Thank you very much.
Yeah.
Over to you, John.
I would like to focus on the consent process. The distinction between a study that is focusing on sexual health versus abuse or some sort of other violation is important, because we require in our assent forms and parental permissions a disclosure that says none of the information that the child discloses to the researcher will be shared with the parents. And that covers your sexual health behavior kind of category. But it also says that if an incident of abuse or some sort of other reportable event is disclosed, that we will have to report that to the authorities. So I think it's important that both the parent understand the limits of what will and won't be shared with them, and that the child understand, and hopefully you can explain it well to them, that if they do disclose something that you have to report, there will be reportable consequences.
Thank you, Joan. Thank you so much for the comments so far. I see that there are a number of comments coming in the chat box. Colleagues in the Johns Hopkins Bloomberg School of Public Health are listing them all. And in the 20 minutes of discussion that we have allotted for this session, we'll be able to touch on up to 6 or 7 of the principal ones that have come up, but every single one of them will be responded to by the 3 panelists and by Professor Bob Blum and myself, and then we'll make them available in a public place, and Bob will talk about that at the end of the session. But thank you for your comments. Please keep them coming. So you've talked about things that you want to know. What protections would you ask, and what are the responsibilities of investigators? This in a wonderful way, in a very good way, leads to the third question. The next slide, please, Gwen, which is, it's well and good to ask about, about the consent process and about what counselors are available, what mechanisms are put in place. But in many places where these studies are carried out, basic infrastructure and health and counseling services, and even legal justice services are very weak. What do you consider best practices for researchers proposing to undertake studies in potentially sensitive issues such as sexual and reproductive health, emotional trauma, or sexual and physical abuse? For example, Professor Bob Blum is the principal investigator of the Global Early Adolescent Study, which looks at gender socialization in boys and girls in young adolescents. And it doesn't set out to ask about emotional trauma or physical abuse, but this is something that comes up in site after site. And so then the question is, as you move into this, what do you think are best practices? And I would like to add a rider, taking into account that we have 25 minutes left, so you have quick responses. Do we have completely different rules for research and for projects and programs? Who'd like to go first?
I could do it if you wish. This is Joan. I think the best practices, and I really appreciate all the comments of the other panelists, because I think we're covering a lot of, we've already covered them, but if to list them, be thoughtful about the actual social risk to participants, their vulnerabilities, and the local context, and mitigate those risks. Understand the reporting requirements of the local site, include in the consent forms the disclosures that will inform your participants of what you plan to do with the data, and then provide counseling either through the study or, find the local resources if they exist.
Thank you, John. Abba, Jerome?
So, yes. So, Chandra, I think your question was, are the rules for research very different from the rules for programmatic?
No, that's the rider. Firstly, what are best? Okay, please go ahead.
So for me, the best practices for researchers is, I think they have to anticipate the consequences of their study. So as you said, in the global adolescent study, there were issues related to participants actually asking or revealing what was happening, or revealing sexual abuse, or revealing things. And I think that has to be anticipated, that these sort of questions will come up, and therefore we need to be prepared to handle them. If we don't have the wherewithal to do that, perhaps that study should not be undertaken at that particular time, till we have the possibility to manage the counseling, manage the support that participants need. If it's not available at the site, then the research study itself should bring in the resources to provide that sort of support. I think it's important that if we approach participants to take part in research, we should not leave them worse off than before.
We shouldn't leave them worse off than before. I think, and that's I think something everybody will agree with. But then, but one of the questions is, and that's open for discussion. It's not a statement. Are we setting the bar too high for research, so that many potential research studies are not done if the bar is too high? Is it better that the study is not done at all by setting this bar very high? That's something I'd like to see discussed. Over to you, Jerome.
Chandra, maybe just so that I'm very clear on this, there were several different questions I got asked and different answers from the two other people. What question do you want me to answer? Because both Joan and Abba answered slightly different questions.
No, I think what I heard Abba say is that her answer to the question is that the same rules apply for research and programs. So you can answer both questions, which is, what do you consider as best practices for researchers? And secondly, are these best practices different for programs? Over to you.
I'll start off by maybe considering best practices for researchers. And I think number one, capacity building is very important. And under that particular point, I'll say sensitize your study staff about any social or cultural factors that may be relevant to the issue. So again, I'm just going back to the issue of child marriage.
Jerome, could you speak up a bit, because your voice has become a little faint through the session?
Okay, I've got it on full, so I'm not sure where the problem is. But in terms of, I think probably for me, what is important is doing capacity building, sensitize your staff about social and cultural factors that may be relevant to the issue in that particular context. Sensitize your staff about abuse laws. Tell them what is the definition of abuse, what are disclosure obligations, different ages of consent for different sexual types of acts. And I think number three would be draft a study, standard operating procedure to govern issues of abuse, and enjoy this of course has to be to ensure your consistency with how different staff handle different matters. I would say number four would be your informed consent form should clearly stipulate that mandatory disclosure obligations apply, and so you don't have the unrealistic expectation on the part of a study participant, a child in this case, or an adolescent, that whatever they say is going to be kept confidential. I think another question that I would consider best practice is establish what standard of care you would provide in a particular case. In this case, it would be, are you providing counseling by trained counselors, or is it lay counselors? Are you doing referral? I would say if your referral is amounting to long waiting times, the study should provide counseling and referral to authorities. The seventh point I would say is consider your ancillary care obligations. Are you going to provide contraception, sex-safe counseling to legally consenting sexually active adolescents? Are you going to be doing referral to STI treatment facilities? Those are all the ancillary care issues. And lastly, I would say rigorously document everything. Because if you are dealing with a situation of somebody telling you to report or not report, a child begging you to not report, you need to document why or why not you are taking certain measures.
Thank you, Jerome, and thank you, Abba and Joan. So you pointed to a number of things that you believe absolutely need to be done for researchers embarking on studies in these sensitive areas. What we'd like to do now is to get into a discussion, and I'll explain the rules of the game in a minute. But what I want to stress is that the points raised in this webinar will be summarized and made available to all. We will also provide you with a short list of documents that carry some of these recommendations. WHO, for instance, has published guidelines on carrying out research on violence against women and girls. And so there are a number of normative guidelines which carry some of these recommendations which are available, which we could share. But thank you for your comments and questions. What we have done is we have captured these questions, and in the interest of time, I'm going to pose the question and then ask one of you to take it up and answer this question. The first question is, how should researchers address situations where adolescents are abused by parents, report being abused by parents, but in that situation, because they are minors, parents are also responsible for providing consent for research. This has been touched on by Joan, and from the very beginning, she's talked about vulnerability and about the consent process. So can we have some quick responses to this, where you can, with some practical illustrations? Of course, you can't mention names, you can't even mention specific studies, but as close to the ground your answers are, the more interesting it will be for all of us. Joan, do you want to start off, because you're the one who has touched on this several times?
Sure.
So the question is, if the adolescent reports being abused by a parent, and the adolescent is a minor and the parent is also responsible for providing consent, what do we do?
So in the United States, we have no choice because we must report. Thus, you put in your consent form that you will report, so the parent knows that that's going to happen. And that may affect whether or not the parent allows the child to join the study. We have had situations, I remember one vividly, where one of our researchers was doing work with sex workers in Baltimore City, and one of the sex workers in the study was a minor who lived with her mother, and the mother was the abuser. So you already have an extremely vulnerable adolescent. I believe the board had waived parental permission for this study because we have a provision in our code that allows waiver if it's not appropriate under the conditions of the study, and in this case they did. But at that point, the study was responsible for providing some sort of care for this adolescent to help the transition that was precipitated by the report. And when I mean transition, I mean whatever event occurred during the legal authorities coming in and intervening. So anticipating what might happen as soon as you can when you're reviewing the study is essential.
Thank you, Joan. Very quick comment. You're obliged to report, but there are waiver possibilities. Abba, Jerome, a quick addition to this. Please don't respond to this question. I'd like to go to the next question. But my question to either of you is, are these waivers used often enough, or when they can be used? What's your sense?
I think IRBs have a great responsibility, and they should anticipate and be willing to provide waivers where relevant. I'm not saying everyone should receive a waiver.
My question to you, Abba, is do they?
Yes, I think the WHO's ethics committee does. It has to take into consideration, though, what are the legal aspects in that particular situation and whether law allows any leeway. And if it does, then I think that should be taken advantage of.
Jerome?
I think ethics committees globally do make waiver of parental consent. And I think the guiding principle, which is what's in international law and also a basic ethics principle, is always act in the best interest of the child. So if it's in the best interest of the child not to get parental consent, to elucidate an abusive practice, then I think that's what should actually happen. And I think I'll very briefly touch on there's protocol deviation, protocol violation, and protocol exception. You can always ask your ethics committee for protocol exception if you have not made a waiver of parental consent part of your study. And that means basically getting their permission to deviate from their protocol in an exceptional case.
Chandra, may I chime in on one more point?
Yes, very quickly, so that we can go into at least two more questions.
So when we do waive, we ask the PI to provide an alternative mechanism to protect the participant. And locally, we've used social workers, somebody dedicated explicitly to talk with the potential participant, the minor, to advise on how to make a decision about joining the study.
Thank you. Thanks to all three of you. Pushing you to the next question. And I know, once again, I want to say to everyone that we will have brief answers to each of these questions made available to all of you subsequently. The second question is, how should an IRB examine the risks and benefits of mandatory reporting? Sometimes there's a law in place that requires researchers to report on issues such as parental abuse, or on issues in some contexts about sexually transmitted infections. And the enforcement of the law can actually put the young person, the adolescent, the young person at risk. What are your thoughts? What are your personal experiences in dealing with the mandatory reporting? Of course, this is a requirement, but how do you manage the ethical implications with the legal imperative? Maybe I should ask you this, Jerome. I know you struggle with this a lot in your work.
I think there's in some cases there may be an absence of law to cover certain categories, and I think that it is a good illustration of where you don't necessarily have to have a law to comply with your ethical obligations. So I think in some cases you may have a law that may make it mandatory to report something, but of course on ethics grounds it may not necessarily be the right time to report something on legal grounds. It may not be in the best interest of the child if it's going to put them in immediate danger. So I think there is a tension sometimes between law and ethics. I think that in some cases where the law makes it mandatory, they may not make it specific to a certain time frame, and so in which case you may need to in fact defer that reporting until such time as the child's safety or welfare is taken into account. So I'll just keep it very short and just say that in some instances the law may be absent, in which case you're obliged to do something on ethics grounds. In some cases the law may oblige you to report something, but if you do it too soon you may in fact endanger the child. So you've got to consider both law and ethics when you're taking the situation into account.
That's right. And of course, in addition to protecting the subjects, to also protect the researchers in such contexts. Abba, Joan, do you have any quick additions to what Jerome has said?
I think the important thing, see, it's not an easy situation. It's a difficult situation that you're talking about, Chandra. And I think from the IRB perspective, they need to keep the interest not only of the child, but also of the family. Like if reporting is going to impact on family situations, then they have to see what whether that needs to be, whether we need to keep those sort of questions. Perhaps some questions can be left out. Perhaps protections need to be in place before the research starts. But I think the important thing is anticipate and also know the law as well as you can. As Jerome mentioned, there may be things that you don't need to report immediately. You can report later. You have a leeway. So I think that's important.
So echoing what Jerome says, fully understand the letter and spirit of the law and see how you can work around it in the best interests of the child or the adolescent. Joan?
It sounds like we have the most rigid requirements here in the United States. And I also have a university policy that mandates reporting no matter where abuse happens in the world. And Bob has struggled with this with me in that there's some settings where reporting can potentially endanger an adolescent. And so I think Abba's advice to anticipate, so you can put the pieces in place in advance is the only way to deal with it.
Anticipate, prepare, and of course that means learn very well about the situation. We have just under 10 minutes, time for a question, and then time for each of you to say a few words, which I hope you will leave us with, saying that it's not so difficult that, let's focus on other population groups. I hope you will leave us with a hopeful message, and then I'll ask Bob to come in with some closing comments. So the third question is, as a researcher conducting a study on sexual and reproductive health and rights with young adolescents online, what type of consent are you required to obtain and from whom? And then what are the other safeguards that need to be considered? Because consent really is meant to be a means of protecting the adolescent. So in addition to consent, what are the safeguards? So increasingly, there are studies, online studies. So over to you. Who'd like to start first? And again, very quick comments in the interest of time.
I guess I'm the pushiest one of the group. I would say online studies are tricky because, number one, you don't really know who you're getting to answer your questions. But the concerns are mostly about data security and confidentiality. So if you're having an online question, the IRB might consider that to be a minimal risk study because the risks attendant to recruitment and consent are minimized. And whether or not the respondents are identifiable to you is a critical point.
Thank you. Abba, Jerome, do you have anything to add to that, or we can move on to one other issue?
I think in internet-based studies, not only is it a question of protecting the confidentiality of the person, but it's also whether the answers that the person is giving are actually somehow or the other visible to the other people on the same internet site. So that needs to be taken care of as well. So the identity of the person providing responses should not be seen or be available to others on that chat group.
Okay, let me move to the fourth question. There are two more questions, and I'd love to have all your answers to them, or at least one or two of your answers. So we've touched on parental abuse. We've touched on mandatory reporting. We've touched on online studies. And the fourth question is, what are the factors that researchers need to consider for adolescents in relation to confidentiality that may be different than for other populations? So I'm going to really ask you for very quick bullet points, starting with you, Jerome, and loudly, please.
I think probably when you're looking at confidentiality, especially in the context of children, you've got to take into account that a child needs to understand what does confidentiality mean in the first place, and that the other side of confidentiality is your disclosure obligations. So, sometimes people confuse confidentiality and privacy and also access to documents from the study participant. But I think you've got your challenges to get a study participant, in this case, a child or adolescent, to understand that while you have a right, or while they have a right to confidentiality, confidentiality has to be balanced with your obligations to report to relevant authorities if there's certain requirements that are met in terms of a mandatory disclosure obligation. So I would say explaining the context of confidentiality is not absolute, and getting a child to understand, or an adolescent to understand, that this may in fact entail you breaching their confidentiality if it's justifiable to do so.
Thank you, Jerome. Abba, Joan, would you like to add something to that?
Yes, from my perspective, Chandra, the thing that is different for adult or for minors and adolescents is the fact that often the consent is given by parents. The adolescents are only giving assent, but the parents are not privy to the information that the adolescents divulge to the researchers. So they need to understand that even though they've given permission, they will not receive the responses that the adolescent has provided the researchers. And that's where the confidentiality is key. Otherwise, the research could not take place. Adolescents won't be open enough about the responses, and researchers will not get the right responses. So I think that's key.
Thank you. Many times we hear principals of schools telling researchers, yes, I signed the confidentiality agreement, but I want to know something about my pupils. Tell me something. And that's a challenge. Joan, over to you, please.
Okay, sorry about that. I think the other issues concern recruitment and consent processes. Sometimes studies involve children with certain infectious disease status like HIV. The parents may or may not know about that status. So, you know, we have situations sometimes where it's not clear what should come first, the assent or the consent or parental permission, and that needs to be considered. Also, when you are recruiting, I've seen studies with group consents, and that may not work in a school setting with an adolescent, where if you raise your hand, then you might be stigmatized. So things like that have to be thought about too.
Okay, thank you. Thank you all. We are nearing the end of our session. Many of the participants from the chat box talked about the different expectations of researchers and programs. So in your concluding comments, can I ask you to take, each of you to take 30 seconds to say, do you think they need to be different? Are programs, are the obligations, ethical obligations of researchers and programmers different? Yes or no, and a short answer, which is a sentence which is not longer than 20 words. Joan.
They should be the same.
They should be the same. Abba.
So I would like to there's a caveat. I agree with Joan, and that yes, they have the same ethical obligations, but I think the situations are different. Researchers are not meant to prove. So whatever researchers do is not meant to be for the best interest. It's not meant for their good. Whereas in the programmatic and when you're in a clinic, the physician is meant to be responsible for the best interest of the patient. And therefore the obligations in terms of, I think it's clear in the clinic setting what the physician's role is. It's not so clear in the research setting. And therefore there is a little difference, but I think the ethical principles are the same. I'm not sure if it's clear, but
Joan was categorical. Abba said not completely clear. Jerome, your last word.
Research is investigational, programmatic is therapeutic. So I think there are different ethical obligations. And I think when you're doing research, in a sense, your obligations are even higher, because in many cases, there's no therapeutic benefit for some study participants, not anything immediate anyway. You're trying to elucidate the answer to a question, not necessarily going out there deliberately to help them. So I think that there are different ethics considerations to take into account.
Thank you. Bob promised us all at the start that we would finish on time, and we are just nearing the end of the hour. I'd like to thank all the panelists, Joan Petit, Abba Saxena, and Jerome Amir Singh, for engaging in this discussion with us. and doing so well. I'd like to thank Professor Bob Lim, Leah Koenig, for all their help in, for first of all, their leadership in convening this session and for bringing it together. And to my colleague, Kelly Vantreat, for her help with fielding the questions. So grateful thanks to you all, the panelists, Johns Hopkins staff, and all the participants to contribute to the success of this event. Bob, any last word from you?
My only last word is thank you. And thank you both Leah Koenig and Quinn Barnett, who also did a lot of behind the scenes work. And Chandra, you did a masterful job in facilitating this really extraordinarily wonderful conversation. As we mentioned at the beginning, the voice recording is going to be available. And we hope that the conversation, ideas, and suggestions prove useful to you all. Have a wonderful remainder of the day. And thank you for joining us.
Thank you ever so much. All the best. Bye.
Thanks, everyone. I think it was a great experience. Thank you.
Thank you.
Bye.